Hello, everyone. I think we'll go ahead and get started. Thank you for joining us for our virtual CU Anschutz Wellness Series, Happy and Healthy Hour. We're thrilled that you're taking the time today to connect with the CU Anschutz alumni community and focus on your own wellness. My name is Robin Burton. I graduated from the Colorado School of Public Health in 2018 with an MPH with a dual concentration in environmental and occupational health and global health. During the program, I took an interest in the intersection between energy, climate change, and health. And after graduation, I went to work for the National Renewable Energy Laboratory in Golden, where I'm a research analyst in our Strategic Energy Analysis Center. For those of you attending your first Happy and Healthy Hour, this series was developed to provide practical tips to support your self-care as health professionals. This series has covered topics from sleep health to the positive effects of animal connections to burnout in healthcare professionals. Today, we bring campus expertise on a topic that affects all of us: COVID-19 risk and personal protective equipment, or PPE, protecting yourself and your family. I now have the privilege of introducing tonight's speaker, John Adgate, PhD, MSPH. Dr. Adgate is the chair of and a professor in the Department of Environmental and Occupational Health at the Colorado School of Public Health. He was department chair when I went through the program, and I had the pleasure of getting to know him during department social events he hosted at the start of each term, in his risk assessment course, and as one of my capstone advisors. So it's my real pleasure to introduce him tonight. Dr. Adgate's research on exposure science, risk analysis, and children's environmental health is focused on improving exposure estimation in epidemiologic studies by documenting the magnitude and variability of human exposures to chemical and biological stressors. He's been giving talks on airborne exposure and particles for most of his career and has taken a keen interest in how we prevent COVID-19 infections by masking and other interventions. His current research focuses on the risks, health, and community impacts of oil and gas development, the impact of heat and air pollution on the development of chronic kidney disease in Guatemalan sugarcane workers, and exposure and health effects stemming from perfluoroalkyl substances or PFAS exposure. And now I'm happy to turn it over to Dr. Adgate.
Thanks, Robin. So I thought I'd start here because we're all in the era of social distancing. And you'll forgive me for making use of this, but it I think demonstrates what we're all sort of feeling now, as well as seeing. Everybody's wearing a mask now, or should be, but this is not a new phenomena. I pulled this picture up from actually the National Geographic, and this is a photo from 1918 in Seattle during the last major flu pandemic. And you can see here people are wearing masks, including the conductor on this streetcar. And what's striking to me about it is I've thought and worked on this problem is how little things have changed in many ways. The viruses come and the viruses go, but they had similar issues back then in terms of people not wearing to wear masks. There were actually marches in Philadelphia and other places by what was called the anti-masking movement. So you can see the realities that we live with today haven't changed much in a little over 100 years. So I titled this, PPE, protecting you and your family, really because I'm focused more on what's going on outside of work. I mean, some of the masking stuff I'm going to talk about obviously relates to what people do at work, but I think where people are most concerned and confused is really what to do in all the other spaces that we have been in habitually, or we'd like to be in, because at this point we're several months into the pandemic and everybody is anxious and stressed. So I asked actually when we were putting this together, who I was going to be speaking to. And so we put this poll together just to give me some idea, and it would be helpful if you filled it out, is your affiliation. And we'll, not that it's going to change a lot, but it may change some of the things I have to say depending on people's interests. And there will be time at the end for questions. So please feel free, and Noelle, who's running this poll, will put the results up once you've all have voted. So I see 16% from the School of Medicine, 22% from the School of Public Health, and a range of other folks, faculty and staff, School of Pharmacy, Dental Medicine, College of Nursing. That's great. That's it's a wide swath of what we do at Anschutz. All right, so I've got sort of three things I want to talk about today. One, I'm going to give you, it's a bit sort of researchy, but I want you to see sort of how public health gets practiced. And so I want to talk about aerosols and droplets, and I'll talk about what those are in a bit, but it's really about how COVID-19 has been and is being transmitted. And then I'm going to talk about masks because that's the personal protective equipment we're most familiar with in this context. And there's actually been a lot going on around this. I've got all sorts of resources at the end. And believe it or not, one of the more interesting places to read about some of the science being vetted is Twitter. And there's a number of people in Colorado who have had very active Twitter feeds who are doing studies and for example, singers and musicians. Shelley Miller in Boulder is doing some work on that. And others are doing things like testing masks and doing any number of other things that I'll go through in a bit when I call those studies up. So I'll talk about a little bit about aerosol science, masks, and the virus on surfaces, which was a focus at the beginning of the pandemic, but is less so now, I think, for some very good reasons that I'll go into. And lastly, we'll get down to some very sort of practical stuff, some of which you may have heard before, but others that some of it's new, some of it's fairly comprehensive, and we won't be able to completely go over, but I'll point you to some really good resources that I've found and have been reading. So Robin gave you a little bit of my background, but what I do as a scientist is in public health is what's called exposure science, and it's really about following people around and finding out what they're exposed to. Now, in public health, we work with this paradigm that we call the hierarchy of controls, and a lot of what we try to do with social distancing is according to this hierarchy, it's elimination. We're trying to keep people away from, any sort of source or setting where they might be exposed. Now you can see this is an inverted triangle because it goes from the most effective to the least effective approaches for controlling an exposure. So, you can substitute, you can only leave for essentials, hand washing or engineering controls, administrative controls, keeping 6 feet away at all times is it's a rule. And lastly, there's personal protective equipment, or PPE, and that's, in this case, masks. So moving from most to least effective, you can see here that, masks are actually at the bottom of the pyramid. Now, they will, if everybody wears them and wears them right, and they practice these other things, have a major effect. There's a number of studies out there showing that. But it's still elimination, it works best. All right, I mentioned this briefly, one of the big things about COVID-19 and how it's transmitted has been the initial guidance from the World Health Organization was really around hand washing and a little bit on droplets, which are some of the bigger particles, and I'll talk about that in a minute. But there's really been very little research done on this. And a lot of bad assumptions were made, I think, early on. Big emphasis on hand washing and cleaning surfaces, but ignoring the possibility of airborne transmission, which I think a number of events have shown is really a big deal. One of the most famous of that, if you haven't heard about it, is the choir practice in Washington, state of Washington, where a huge percentage of the people in this closed room who were singing for an hour or more, and one infectious individual managed to infect almost the entire choir. You can read about it in MMWR, the CDC publication. But my point being is there's been all sorts of events like that that demonstrate that airborne transmission is important, and probably as important as surface contact. Certainly, and this is outside the occupational environment. In hospitals, the story's a little bit different, but airborne transmission is still quite important. And I felt like this for a long time. I was trained in aerosol science as part of my education, and that's not something that's typically on the curriculum in the health sciences. So I signed on to this letter by a very famous health physicist, Lydia Maraska, and Don Milton, who's a virologist and physician, who's done sort of fundamental work on transmission of viruses, and which is a tricky business. So we urged the medical community and the public health authorities to stop focusing as much on fomites, i.e. surface transmission, and more on airborne transmission. And a couple of headlines here on the right side of the slide about the mounting evidence. This is from a Nature article in July. And then a quote from Lindsay Marr, who's been working on this most of her academic career. She's one of the Twitter feeds that I cite at the end, which says, even for the flu, which we've studied for decades, we still don't know how much is transmitted by aerosols or by touching contaminated objects, or fomites, that is the technical term for that. So what shifted is that this thought that hand washing would solve everything to we need to do other things besides that, including that, but besides that. So this is a little wordy, but the main message here is I just want to give you some sense of the size of things, and then I'm going to show you some images. So the virus itself is about a tenth of a micron, and just for some context, a hair on your head is about 70 microns in diameter. You've probably heard of things like PM 2.5, that's particle air pollution. But when we talk about the transmission of the virus, we talk about two things. One is droplets, which are particles bigger than approximately 5 microns, and aerosols, which is everything smaller than 5 microns. And what we can generate aerosols by talking and shouting and singing and doing all sorts of other things. And the contagious individuals transmit the virus that way. Now, the bigger droplets settle relatively quickly in most environments, although even I'm in a room by myself talking, the aerosols I'm emitting just by talking to you are in this room, and they'll be here for a while because it's a still environment. But if I wave my arms, that helps keep them up. Now, if you think about if you're walking around in a store or any sort of public space where there are people, just the fact that people are walking around helps resuspend and keep them up in the air, even the droplets. The smaller particles, the aerosols, are naturally in the air longer because they're smaller and they tend to stay, they're buoyant. They will stay in the air for minutes to hours, depending on what's going on in the space we're talking about. And it depends on ventilation and if there's air cleaning and all sorts of other variables that you could expect. But so coughing, sneezing, singing, yelling, speaking all generate aerosol particles. And if you're shedding the virus, you're a source that can infect other people. So this is a picture of what I just said. I'm going to annotate it ever so slightly because I think droplets can, when there's some turbulence in the room by people moving around, can still result in airborne transmission. Now, the 6-foot rule really comes from this thought that droplets generated by coughing or sneezing are going to drop relatively quickly. And they can, but it depends on ventilation and things like that. But this is the basic idea: is you atomize and create aerosols and droplets, and they're transmitted to people at some distance, or they can result in sort of contact transmission by getting some on a surface that people then later touch. But a lot of what we think happens is this dispersion in air across spaces that results in the virus getting into people. Now, I thought this is a really good summary. This is one of the people I was citing their Twitter feed, Lindsay Marr, who's an aerosol scientist at Virginia Tech. She spoke at they had a National Academy of Sciences webinar about 3 weeks ago. And this is the summary of her presentation, which I thought was really, it was an excellent presentation, and this is a great summary. It says, breathing, talking, coughing, and other activities produce 100 times more aerosols than large droplets. So there's a lot more of those small particles. And that matters because dose matters, but they also travel further. So aerosols may contain infectious virus that remain suspended for hours and can be transported many meters from the source. There have been people who've at least estimated they can travel up to 60 feet and still be infectious. Now, these are really hard experiments to do, but the basic physics and aerosol science of it is pretty clear. How long things, virus particles stay viable is still unknown and hard to predict. But there's work going on that as well, although the methods are difficult and somewhat crude. They're using things like PCR, but catching viable viruses is a trick in and of itself in the air. But we know for sure that it happens because of events like the Washington Choir Loft event and many others that are really sort of proof of concept. All right, so our remedy to this, and one that I think has been successfully before, is using masks. So I thought I'd talk just a little bit about the aerosol science of them. You've all probably heard of an N95. That's a mask that, if you're in the healthcare setting and working, it's a mask that I'm sure you're familiar with. But it's, I wouldn't have predicted a year ago that this was something that everybody would be familiar with. But what N95 means is they're efficient at filtering particles of 0.3 microns. Now, 0.3 microns seems like an odd number, but it's the point where things go from sort of classical physics to the new physics in terms of Brownian motion, going from a particle that will move in a straight line to a gas that will bounce around like a drunk person. So they're the hardest things to filter out, which is why that's sort of the test, the point of testing. They generate those very small particles, the 0.3 micron ones, and that's what they use to test and verify that N95s are 95% efficient at removing those small particles. Filtration is really important in terms of mask performance, is the point there. But the other point is that how you wear your mask, i.e. mask fit, is also really important. It's as important as the quality of the fabric. If you're wearing the mask wrong, it's all sorts of problem. It's a problem. Now, we've all been places, I'm sure, in the last few months where you've seen somebody who's wearing their mask just on this part, or the famous picture of the guy in the airplane with a mask over his eyes, and but not on his nose or his mouth. So seal matters, filtration matters, multiple sizes are needed, and in the work environment, they actually fit test people. I'll show you an example of that in a minute. So a couple of pictures just to get us thinking about what I was just talking about. This is a thing on aerosol, what I'm calling aerosol mechanics, but it's really about how far do particles that people cough or sneeze out go. Larger, what's here called large spray droplets will pass 2 meters or so at least, indoors in a still environment. And that's sort of where the 6-foot rule comes from, because 2 meters is about 6 feet. Now, the smaller particles what here is called large spray droplets, what I've called aerosols, can go at least as far as 18 meters, 20 feet or more indoors, particularly in still environments. They will stay afloat. And like I said, once you start having people moving around, a little ventilation, stuff will stay airborne for quite a while. Now, once those droplets and the aerosols have traveled beyond 6 feet, or at less than 6 feet, how they enter the body is through, obviously through the nose and the nasal pharynx. But the bigger particles, the ones that are 10 or more, are usually fairly efficiently caught in the back of the throat. You have sort of what's called a cascade impactor back there. Now these bigger particles are blocked by surgical masks or caught by most masks for reasons I'll talk about in a bit. Whereas the smaller aerosols, the ones that go down to 0.3 microns, are really only blocked efficiently by an N95. But these are the ones that also get way down into your lungs, because it can penetrate deep and cause infection there. So masks are effective at reducing airborne transmission for two reasons. One, they at the source, if the person is infected but asymptomatic, you can see here on the top, this is a nice graphic by Kim Prather that was produced in Science. And you can see here both particle size indicated by different colors, and then the concentration, how that changes once you're wearing a mask. So this idea that the mask protects both the wearer and the wearee, so to speak. Obviously if the wearer is already infected, that's not protecting them, but it does provide some filtration from the droplets and to a certain extent to aerosols. Now people are, in this particular graphic, are wearing surgical masks, and I'll define those in a bit here. But the whole point of trying to reduce transmission is everybody wearing a mask will keep those asymptomatic people who are shedding virus from infecting healthy folks, and therefore help reduce the R0 that sort of drives the transmission process in a pandemic. So here's just a picture of an N95 and sort of a reminder. These are highly technical. There's a whole interesting history of the woman at 3M Corporation who actually invented this back in the late 50s, early 60s. It's a filtering facepiece respirator. It's a very high-tech polypropylene fabric, but it is damaged by solvents and heat, so you can't clean them very easily, although there's now a process has been developed to do that that I won't go into. But what's interesting and what you'll see is you'll see people around now wearing these masks, which are the ones that you can buy, you used to be able to buy at Home Depot, kind of it's the same idea, but it's for particles that typically aren't infectious. Now what's interesting about using these, though, if you look at the industrial mask that I show here, those have an exhalation valve on them, actually, and that is not a good thing in this context. The healthcare masks do not, whereas the industrial ones do, because people are, I'm not saying the healthcare workers don't exert themselves, but the industrial application is a little bit different. So they're not actually, the ones with the exhalation valve actually are a problem, particularly if people are shedding virus, and I'll talk about that in a bit, because they just don't work as well. In the end, though, their medical N95s excuse me, provide both filtration and droplet protection, or what's called splash protection. Now, I mentioned this, excuse me one sec. Fit matters. OSHA requires people who are, healthcare workers to be tested annually, and they use a couple of different ways to test this. And you put the mask on, and they use spraying an aerosol of saccharin, which is sweet or what's called Bitrex, is a bitter substance, into a hood while going through specific exercises to make sure that the fit is right. And N95s are made a number of different sizes and ways, and it's one reason why beards in wildland firefighters and healthcare workers are sort of frowned upon, because they affect mask fit. So that's an N95. The thing that we're seeing increasingly, I think, in public now, even though they've been used in healthcare settings for a long time, is, and I have a box of them upstairs in my house, is these surgical masks, which are multi-layer synthetic fabric. They're tested to resist blood splatters and provide some filtration, but there isn't the face fitting requirements, and they protect against those larger particles, those greater than 5 microns, the droplets. All right, so those are masks and what they do in the two most common kinds. I'm going to come back to kind of homemade masks in a little bit, but I want to talk about other places that one can be exposed to the virus, and that's surfaces. And we spent a lot of time, I think, particularly early in the pandemic, cleaning doorknobs and worrying about that. Now, here's what we know about this COVID-19 disease virus, is that people are shedding the virus before they sort of showing symptoms. And it may be for up to 6 weeks, which is surprising. Now, when the virus exists on surfaces, it depends a lot on how much is deposited. If it was a major cough or sneeze that on a surface right next to you is a very different thing than across the room, even in symptomatic people. But this sort of transfer from the surface to skins and eyes and mucous membranes when people are touching their face, for example, are an issue. And we've known this for a long time about everything from the flu to the classic example being the measles. Now, if you think about transmission and trying to model this, what scientists typically use is the half-life to estimate how long a virus is going to last on surface, just to do some of the modeling once they do the basic experimental work. And it's sort of the time you can't measure the virus on a surface. So you start with an initial quantity and you spread it on the surface and see how long it lasts, essentially. So just a couple of quick slides on this. There was a study done early on using a related coronavirus on these surfaces, and these are all very fancy things. But they picked copper, cardboard, steel, and plastic, and some of this received some big part of the news early on. And the way it got reported, I think, was a little misleading, because it seemed like things didn't last as long on copper and cardboard, but a lot longer on plastic and steel. If you look at the bottom here, that's what these violin plots suggest. Now, part of this that is a little misleading is that it depends a lot on how much is on the surface. So they found this, but the times to virus undetectability depended on how much they deposited initially. So the longest half-life of 6 to 9 days on plastic is almost certainly an overestimate, because it's very hard to get millions and millions of viruses from a cough or a sneeze at one point on any surface. It's almost what I'm calling here the perfect storm. And if you have the perfect storm, a lot of it, the virus will be inactivated over time. These coronaviruses have the corona refers to like the surface, or the bag essentially around them. If you look at one of these under a microscope there, they have a coating on the outside that is where the name comes from when you look at it under a microscope. It's the corona, or crown, I think is the Latin. But disinfection and sanitizing, cleaning these things up on a surface is important, but it in most cases, I think the virus is likely only viable on the surface for hours at the most. So while it's good to clean high contact surface area, doorknobs being an example, the good news is that I think we've all heard that, you know, the common soaps and detergents, and not even the fancy ones, the quaternary ammonium compounds, for example, don't necessarily have to be used. You can use old-fashioned soap and water or hand sanitizer that's 80% methanol or more to you wipe out the virus almost immediately. Now, I mentioned earlier that they're starting to, they've been exploring, you know, reuse of N95s, but this involves fairly specialized equipment, using ultraviolet light or hydrogen peroxide vapor to get back to the specs where they could be reused. All right, so I've talked a lot about sort of airborne transmission, and I thought real quickly I'd address sort of ventilation, because it's a big issue. I could give a whole nother talk just on this, but what I'm really going to do is show you some resources and you know, the basic idea with trying to cut down on airborne transmission is the more ventilation there is, the better off the people in that space will be. The converse is that we should avoid being unmasked in busy places indoors with not much air exchange. So it's typically considered, or the metric that scientists use is air exchanges per hour. So you want to get much more than one. The example I'm showing you, you can see sort of the shopping area. It looks like a Costco or someplace like that. In the upper picture, I just grabbed that off the internet, but the lower picture is actually from a New York City subway car, which have surprisingly high air exchange rates because of the movement, stopping, starting, and the HVAC systems in them. The air turns over in a subway car, turns out, 18 times an hour, which is why I think we've not had, at least in that kind of public transportation, nobody's traced back to public transit system like that a major outbreak. But you can see in this case, people are both socially distancing and wearing masks in this example. Now, obviously, filtration can help in these environments as well, and how that works in schools and other places, or maybe restaurants, is tricky because it depends on how the system was designed, how much the capacity of the air handlers, and all sorts of other things that I'm not going to get into here. One other thing that people are often concerned about is their schools, right? This is one infographic from a large report put together by the Harvard School of Public Health, is about what we need to do to have healthy buildings and healthy classrooms. And it's really about wearing masks, washing the hands, physical distancing, but also things like portable air cleaners and getting air exchange up where at all possible. But this is a nice report, a good resource if you want to talk to or get asked because you're a healthcare professional about this. I think this is a great resource for schools. They had both time and money to put this together because it's got nice graphics like this, because it talks about policies as well as the engineering of buildings. So to sort of bring this home, I want to talk about what we should do as individuals and try to answer some of the threads I've left hanging. And I sort of frame these as best practices here. We're all wearing masks now, but how should they be constructed? And I talked about already, how we could unknowingly transmit because we're asymptomatic. But the main thing is still physical social distancing, limit our exposure to other people, and stay out of poorly ventilated spaces with a lot of folks, I think is really key. And masks do reduce the spread of virus via the large droplets, but they're probably less effective with aerosols. It depends on the kind of mask you've got. Now, homemade masks, or ones that have been sewn, i.e. things that are not N95s or surgical masks do protect you, but I'll show you some data here on what they do and what they don't do. Here's just a quick how to wear a mask stuff for those of us who aren't clinical on a daily basis or in clinics on a daily basis. I think for folks who work in healthcare environments where they're seeing patients all the time, this is drummed into your heads because it's all about hand washing and proper ways to wear PPE when in ICUs and other healthcare environments where it's become mandatory. So it talks about washing your hands and not touching your face as much as possible to keep away from our mucous membranes, doing the fomite transfer, and washing your mask a lot often. And what that means in the end is having several masks or a combination of cloth and disposable masks. Now you can see the three examples here. They've got everything from a bandana to something that looks somewhat like a surgical mask. I'll talk a bit about that in a sec here because there's data on that as well. What's amazing is how much data has been done in short order during the pandemic. Now, early on, I was making these masks. You can go watch a YouTube mask using what's called shop towels. This guy here created these with a stapler, rubber bands, which are the ear loops, with this material that's these shop towels. I bought some. They're like paper towels on steroids because they're a little more of a sort of a pressed and woven fabric that's a better filter, and they're actually quite effective. They were shown to be relatively effective, as good as at least for droplets. If you had 2 layers of this material, as good as a surgical mask in certain contexts. And what the beauty of this was, you could make them with a stapler, rubber bands, and if you had some of the shop towel, you could make them at home. And I was, at one point in March and April, I was making 25 of them a week or something, and then we would use them and throw them away. Now, there's been more extensive lab studies that were quickly published. Here's an example. This particular lab went through and looked at all the different masks that are shown in this picture here, and it's everything from a surgical mask number 1 down to an N95 number 14 and everything in between. But what they showed was, and which I found really interesting, was the homemade, obviously N95s are the best, but the homemade cotton or polypro thicker masks were better than the N95s with a valve, it turned out. Which is a striking finding. Now you've probably seen lots of people wearing bandanas. They're very thin. They don't work very well, but they're still better than nothing. But these, having more layers is better, is the short story on this and what's most effective. So a couple sort of closing thoughts here. These are my what I'm calling almost final thoughts. There's sort of a haiku on the next slide that I'll talk about in a bit. But here's the take-home messages here. I think there's convincing evidence from controlled experiments, field observations, and modeling studies that wearing masks reduces transmission of COVID-19 for healthcare workers and the public. The 6-foot rule isn't based on much science per se. Further is better. It's sound logic, and it's basic aerosol science that we've known for a long time, that these smaller particles can get into your lungs if you're in the environment. What's unusual about this COVID-19 disease is that the virus has been very good at sort of piggybacking on particles and staying viable long enough to infect folks via this route of transmission. My sense of it now, at the beginning of this, I mentioned the World Health Organization was very focused on fomite, i.e. hand to surface transmission. And I think the evidence is pretty strong now and growing that aerosols and droplets are at least as big a source of what transmission that does happen here in Colorado and elsewhere. So in the end, wear a mask when prudent, wash your hands, and socially isolate is still the best advice, as it was, I think, back in March, although back then they weren't insisting on masks. Now, the last slide is this one. This is actually a famous aerosol scientist, Bill Nazaroff, who spoke at the end of this National Academy of Sciences webinar that I mentioned early on. And what I liked about this is at the end, he sort of turned it into what he called free verse. Outdoors is better than indoors. Short is better than long. Masked is better than unmasked. Socially distant is better than too close. Sparse is better than crowded. Quiet better than loud. Gentle breathing better than vigorous breathing. Risk can be lowered but not eliminated by improved ventilation and air filtration. That's the sum of everything that I've been talking about today. And it's really based on, I think, some interesting work that's been done, observation in people who've gotten sick and recovered, and sort of a range of sort of natural experiments and lab studies that have been done relatively quickly in the near term. So that's the end of my talk. There's this stuff that they wanted me to show you. At the very end here, if you're interested, there are these resources, including Twitter feeds and a bunch of other links that I think the folks who organize this can make available. But here's, I'll turn it over to Robin at this point, and then we will, I'll be happy to answer questions that people put in the chat, and that she's going to help me with proctoring.
Sure, we've got a lot of questions coming in, so it's a hot topic. I'll take them in the order received for no other reason than it seems like the way to go. So here's one about the half-life of the virus on surfaces. Wouldn't cardboard absorb some of the virus, making it not transferable?
Possibly. I mean, I haven't done that experiment. I think what matters for the virus is, sort of the temperature and relative humidity almost as much as the surface would be my expectation. I think if there's anything about the surface that sort of helps kind of nurture it, keep the envelope from being breached, which is, the viral equivalent of death, I think that might keep it longer on the surface, but that's probably still less than the amount of virus that's initially there. If there's 1 million virus particles that are viable and have to degrade, the surface doesn't matter, as I said.
Okay. Here's one related to the slide about the types of masks. This person wonders, can I still wear my neck gaiter?
Yeah, no, that's interesting, that Fisher, the picture I showed of all the different masks they were testing, that's the study that claimed that neck gaiters didn't work and were actually worse than no mask. If you dig into the data a little further, that's, I think, a little misleading, the way it got presented in the press. I think neck gaiters still work there. It depends on how thick they are, and how good they are a filter. If you can, if you can see through it, obviously it's a little different than one like the ones you wear in winter in Colorado when you're skiing. That is more like fleece. I think is going to be a better filter than something that's thin that you can see through. So the neck gaiter, I think, isn't as good as a mask, in part because it may also be some of the, remember I talked about fit being important, and you got to think about where the air can get in and around the mask. So something that seals around the nose and down here is important. Neck gaiters give you that feeling of sort of tightness, but I don't think they seal very well. So it's actually hard to do those experiments. You need a mannequin and a bunch of relatively expensive equipment in a lab to be able to sort of test this out. But again, filtration matters, but fit matters.
Okay. Let's stay on the mask theme for another moment. What do you think about the variolation hypothesis that suggests masks may increase the proportion of asymptomatic infections?
That's interesting, but I haven't heard of it before right now, so I don't have an opinion.
All right, here's another one on masks. If all the elderly in facilities wore cotton masks, do you feel there would have been less outbreaks providing staff had proper PPE and screening?
I would hope so. I would think so. I think there's pretty good evidence, and particularly in Asia, it became this tradition for people who were symptomatic to start wearing masks, and there's fairly good evidence that has reduced transmission, not just of this, but in general when the flu season goes on, and so I think if people had done that, and it probably would have reduced the burden, although, in indoor environments, as I mentioned, things like air exchange and how the HVAC systems operate matter. Now, the masks do help. The couple of key examples I'd cite is, one is there was a CDC in MMWR, they had a study that talked about hairdressers. There were 2 female hairdressers who were symptomatic or asymptomatic but shedding the virus, and they saw 140 customers, but they were wearing masks, and none of the customers became infected. So to me, that sort of indicates the if you're wearing a mask, that really makes a difference for both. In this case, if you move the context to a slightly different place, to a nursing home or a memory care facility, that's really going to cut down the potential for transmission. So undoubtedly, it would have made a difference, as would hand washing and other forms of PPE that would have worked to keep people safe, in my estimation.
All right, let's do one more on masks, and then we can go on to some air exchange. I think you started to speak to this, but do you have anything more to add on the best way to keep cloth masks clean?
Well, it's all, for all of us, it's really hard not to touch the mask. It's almost an act of will. I know, but as soon as you put it on, something starts itching. But that's really important. We've got to keep our hands away from our mucous membranes and our mask, because once you start fiddling with it, it affects fit. Now, so not touching them, I think, is important. I think washing them as often as you can, and I have to admit that I'm often not very good at this. I put it on for 5 minutes if I go to the store, and then I bring it home and I hang it up, and I'll always remember to wash it. But given how long the virus lasts on surface, and given how short I think the half-life would be in that, that doesn't worry me much. But keeping your hands off it to keep it clean, I think, is job one, and washing it as frequently as you can. Luckily, we live in Colorado. You wash it with soap and water. You stick it out on your back porch. It'll dry in an hour. Most days, not the last 24 hours, but it will. You can reuse them relatively quickly, in my experience.
Great. Let's do some indoor air quality. What would be your recommendation for an air cleaner for indoor spaces, and is there an acceptable air exchange rate?
Greater than 1 exchange per hour is the best, but the more you can get up to, hurricane force winds in your house, the better, so to speak. If you can get to 5 air exchanges, that's great. That's much better. But it also depends on, it depends on crowding. I mean, in your typical office environment and home, the systems aren't built to do much more than that. Now, you can do things that help. There are all sorts of YouTube videos, if you want to watch them. If you just search for using a box fan to make a filter. I mean, they're very, or an air cleaner. So you can take a MERV 13 filter, which is the best filter that you can buy, for example, at Home Depot or any other place, and duct tape it to a fan. You can make a portable air cleaner for 25 bucks. And like I said, there's videos online, and those would work. And in fact, you could stick it in a window and filter either the air coming in or coming from some potential source. I mean, this works for wildfire smoke too, for that matter. But the more expensive air cleaners, I start having questions about how effective they are. You want the ones with the HEPA filters. You don't want the ones that use any sort of electrostatic precipitation, because while they're effective at catching particles, they also create ozone. So you don't want to trade one hazard for another. I don't have any brands to suggest, but the ones based on HEPA filters that will up the air exchange in the room are best. And like I said, you can go from the cheap do-it-yourself ones to I've seen commercial ones that sell for $500 or $600. The issue becomes how often you need to change the filter on them, and which can be an expense over time. So I think in cases where you've got somebody who's sick at home, and you need to, and they're a confirmed case or even a suspected case, having one is useful for pulling the virus out of the air to the extent that they emit it. But they need to isolate, they need to wear a mask. Having an air cleaner might help with all the other things that we know what to do. We know to do, like hand washing and keeping your visits short.
All right. We've got a few questions about indoor public spaces. One to do with restaurants, another to do with airplanes. So how do you feel about ventilation at restaurants and other indoor public businesses? And then similarly, what are the risks on airplanes, and is the circulation better than on the ground?
I'll take airplanes first. Airplanes actually have fairly good ventilation in most cases, although strangely often when you're sitting on the ground, not very good. But you still want to, if you still don't want to be too close to somebody. The air tends to move from the front to the back. There's actually some fairly good studies around this, but if you've got to fly a plane, wear a mask and socially distance as best you can. Restaurants, I try to personally stay out of any indoor restaurant. I'm not at this point willing to sit even in a building that's well ventilated. I have gone to restaurants and sat outside, which I'm much more comfortable with. But even that requires some social distancing. I mean, outside is the best ventilation, obviously, because you're not recirculating any of the virus through the air handlers. I mean, there have been examples of air conditioning systems, for example, infecting a relatively large number of people. It was either in Korea or China, I can't remember where a Starbucks, a symptomatic person ended up infecting a large number of people because they were sitting like right under the air intake for the air conditioner, so it was spreading that person's virus particles all around, and they were able to determine this with contact tracing. So, summary is I still personally I'm staying out of indoor restaurants because it's interesting to me when people sit down at a restaurant, they tend to take their masks off for the duration, where what you should be doing if you're sitting at a restaurant is wearing your mask right up until the point where the food comes. But I don't see people doing that when I observe And there's a couple of restaurants not very far from my house that I've walked by and seen that on a routine basis, because you'll have a group of people, which is, I think, actually the real risk is if you're with, 5 other people sitting around a table and nobody's wearing a mask. Even if you're outdoors, there is some finite risk to that. Wear a mask as much as possible. Eat outdoors when you can. Get takeout. Support your local restaurant as best you can. But I'm personally not eating indoors at any restaurant at this time.
Okay. In terms of aerosol versus droplets, can aerosol transportation distance be limited in an outdoor setting more than droplets?
Yeah, it all depends on airflow. I mean, if you think about this, I'm not worried when I'm outside and the wind's blowing, because you get dilution in any sort of breezy environment is really rapid, and getting any sort of infectious particle more than a few feet away from a person is even if they're symptomatic is really hard. In most places that I've been, when I've been sitting outside, there's been enough of a breeze to make a difference. So that the air exchange there is close to infinite, as we say. It's the place where it's been an issue is in small enclosed spaces, lots of people, not much air exchange. The doors and windows shut. So the place remains air conditioned. This is why, bars and restaurants, crowded ones, have been this is where the spreader events have happened, or at weddings and things like that. That are the examples that we're seeing pop up. Outside in the breeze is best.
Here's one related to the healthcare setting. Newer recommendations are advising to move patients out of isolation precautions several days, greater than 10 days after initially testing positive, but are now asymptomatic. Would moving from an N95 to a surgical mask for clinical staff be appropriate?
That's a good question. It's complicated. If they're no longer shedding the virus, if you know that as a fact, I think it might be okay. But I think it depends a lot on the air exchange in the hospital. Are they in a hospital room? I'm not quite sure what the location is, but I would think so. I think hospitals want to keep their employees as healthy as possible, which is why they're probably saying everybody should be wearing an N95 as much as possible. But in the shortage, if there's a shortage of equipment, I don't hear as much about that now. And I haven't talked to my healthcare professional friends in the last few weeks about this. I don't seem to hear it as much. I think the equipment squeeze that we had at the very beginning of the pandemic has to a certain extent been alleviated. But I think if people are not shedding the virus, a surgical mask is probably okay, but it's still not good at filtering out aerosol particles. It's only really good for droplets.
Okay, we're just about at the top of the hour. Let's get one more. I think masks are a hot topic. So how effective are the KN95 masks that can be purchased in retail stores? Are they one-time use only? And then just to sort of tag on, give a preference for surgical masks versus the multi-layered cotton masks. Anything more to add on the mask topic?
From a comfort standpoint, the cotton mask that I use, I think I've got both some disposable kind of surgical masks that we bought and cotton masks. I find the cotton mask a little more comfortable to wear personally. I like the surgical mask because once you use it, you can just throw it away. That's typically what I do. I don't know, that John Vulcan's lab up at Colorado State University, which is one of the Twitter resources I cite. He's been testing all sorts of different equipment that's come in. I mean, the state, I think, initially bought some Chinese or Korean N95 equivalents, and they were testing to see how good they were, if they met the NIOSH or the OSHA standard, excuse me. And he knows more than I do about that. Now, I would expect if people have them on the shelf that they're equivalent or close to equivalent, but I really don't know for sure.
Okay. All right. Well, I want to apologize to those questions that we didn't get answered, but we are at the top of the hour, so I think we probably need to leave it there. Dr. Adgate, thank you for that wonderful presentation. Thank you to all of our attendees for your time this evening. We hope that you'll be able to join us for the next event in this series on October 14th, featuring Dr. Rosario Medina to speak on courageous clarity in setting boundaries of wellness. During this presentation, you'll learn to identify behaviors that predispose us to fatigue and burnout while learning courageous steps in caring for self in the work environment. For social media users, you can connect with CU Anschutz alumni on Instagram to check out stories about your fellow alumni at our newly launched CU Anschutz alumni LinkedIn group focused on professional development. Once again, thank you to Dr. Adgate and to everyone for tuning in and for all you do as healthcare professionals for your campus and community. And with that, I wish everyone a lovely evening.